This is a CBS News special report. I'm Charlie Rose with Norah O'Donnell in New York. President Obama is about to speak at the White House. He will address problems with the veterans' health care system.
The president just met with Veterans Affairs Secretary Eric Shinseki and White House Deputy Chief of Staff Rob Nabors, who's reviewing VA health care policies. Major Garrett is at the White House. Major, what do we expect to hear from the president?
Well, the first thing we expect to hear from the president is no announcement about Eric Shinseki having to resign or being fired or in any way being held immediately accountable for the problems that have arisen under his watch throughout the VA health system itself. The president is not going to call for Shinseki to step down, but he will outline what he expects from Shinseki, plus others, including his Deputy Chief of Staff, Rob Nabors, looking into the vast array of reports started most recently at the Phoenix Veterans Affairs facility, but there have been reports elsewhere about wait lists, phony wait lists, deceiving the public about how long veterans had to wait for health care, and in some instances, veterans dying waiting for that very health care to be administered. The president has not talked about this issue for the better part of 3 weeks, and there has, I must tell you, been a kind of frantic improvisational quality to the White House dealing with this today. They added this to the president's schedule very first this morning, and then now the president coming to the briefing room to address this issue.
Good morning, everybody. I just met with Secretary Shinseki and Rob Nabors, who I temporarily assigned to work with Secretary Shinseki and the VA. And we focused on two issues: the allegations of misconduct at Veterans Affairs facilities and our broader mission of caring for our veterans and their families. As Commander-in-Chief, I have the honor of standing with our men and women in uniform at every step of their service. From the moment they take their oath, to when our troops prepare to deploy, to Afghanistan, where they put their lives on the line for our security, to their bedside, as our wounded warriors fight to recover from terrible injuries. The most searing moments of my presidency have been going to Walter Reed or Bethesda or Bagram and meeting troops who have left a part of themselves on the battlefield. And their spirit and their determination to recover and often to serve again is always an inspiration. So these men and women and their families are the best that our country has to offer. They've done their duty, and they ask nothing more than that this country does ours, that we uphold our sacred trust to all who have served. So when I hear allegations of misconduct, any misconduct, whether it's allegations of VA staff covering up long wait times or cooking the books, I will not stand for it. Not as Commander-in-Chief, but also not as an American. None of us should. So, if these allegations prove to be true, it is dishonorable, it is disgraceful, and I will not tolerate it, period. Here's what I discussed with Secretary Shinseki this morning. First, anybody found to have manipulated or falsified records at VA facilities has to be held accountable. The Inspector General at the VA has launched investigations into the Phoenix VA and other facilities, and some individuals have already been put on administrative leave. I know that people are angry and want swift reckoning. I sympathize with that. But we have to let the investigators do their job and get to the bottom of what happened. Our veterans deserve to know the facts. Their families deserve to know the facts. Once we know the facts, I assure you, if there is misconduct, it will be punished. Second, I want to know the full scope of this problem. And that's why I ordered Secretary Shinseki to investigate. Today, he updated me on his review, which is looking not just at the Phoenix facility, but also VA facilities across the nation. And I expect preliminary results from that review next week. Third, I've directed Rob Nabors to conduct a broader review of the Veterans Health Administration, the part of the VA that delivers health care to our veterans. And Rob's going to Phoenix today. Keep in mind, though, even if we had not heard reports out of this Phoenix facility or other facilities, we all know that it often takes too long for veterans to get the care that they need. That's not a new development. It's been a problem for decades, and it's been compounded by more than a decade of war. That's why when I came into office, I said we would systematically work to fix these problems, and we have been working really hard to address them. My attitude is, for folks who've been fighting on the battlefield, they should not have to fight a bureaucracy at home to get the care that they've earned. So the presumption has always been we've got to do better. And Rob's review will be a comprehensive look at the Veterans Health Administration's approach currently to access to care. I want to know what's working, I want to know what is not working, and I want specific recommendations on how VA can up their game. And I expect that full report from Rob next month. Number 4, I said that I expect everyone involved to work with Congress, which has an important oversight role to play. And I welcome Congress as a partner in our efforts, not just to address the current controversies, but to make sure we're doing right by our veterans across the board. I served on the Veterans Affairs Committee when I was in the Senate, and it was one of the proudest pieces of business that I did in the legislature. And I know the folks over there care deeply about our veterans. It is important that our veterans don't become another political football, especially when so many of them are receiving care right now. This is an area where Democrats and Republicans should always be working together. Which brings me to my final point. Even as we get to the bottom of what happened at Phoenix and other facilities, all of us, whether here in Washington or all across the country, have to stay focused on the larger mission, which is upholding our sacred trust to all of our veterans, bringing the VA system into the 21st century, which is not an easy task. We have made progress over the last 5 years. We've made historic investments in our veterans. We've boosted VA funding to record levels, and we created consistency through advanced appropriations so that veterans organizations knew their money would be there regardless of political wrangling in Washington. We made VA benefits available to more than 2 million veterans who did not have it before, delivering disability pay to more Vietnam vets exposed to Agent Orange, making it easier for veterans with post-traumatic stress and mental health issues and traumatic brain injury to get treatment, and improving care for women's veterans. Because of these steps and the influx of new veterans requiring services, added in many cases to wait times, we launched an all-out war on the disability claims backlog. And in just the past year alone, we've slashed that backlog by half. Of course, we're not going to let up because it's still too high. We're going to keep at it until we eliminate the backlog once and for all. Meanwhile, we're also reducing homelessness among our veterans. We're helping veterans and their families, more than 1 million so far, pursue their education under the post-9/11 GI Bill. We're stepping up our efforts to help our newest veterans get the skills and training to find jobs when they come home. And along with Michelle and Joe Biden and joining forces, we've helped hundreds of thousands of veterans find a job. More veterans are finding work, and veterans' unemployment, although still way too high, is coming down. The point is, caring for our veterans is not an issue that popped up in recent weeks. Some of the problems with respect to how veterans are able to access the benefits that they've earned, that's not a new issue. That's an issue that I was working on when I was running for the United States Senate. Taking care of our veterans and their families has been one of the causes of my presidency, and it is something that all of us have to be involved with and have to be paying attention to. We ended the war in Iraq, and as our war in Afghanistan ends, and as our newest veterans are coming home, the demands on the VA are going to grow. So we're going to have to redouble our efforts to get it right as a nation. And we have to be honest that there are and will continue to be areas where we've got to do a lot better. So today I want every veteran to know we are going to fix whatever is wrong, and so long as I have the privilege of serving as Commander-in-Chief, I'm going to keep on fighting to deliver the care and the benefits and the opportunities that your families deserve, now and for decades to come. That is a commitment to which I feel a sacred duty to maintain.